This is a conversation with David Wallin. Hi, David.
Hello, Serge. Or Serge, as the case may be.
As the case may be. So, David, at this stage of your career and your life, what's really of strong interest for you? What's moving you?
Yeah. I guess the answer would be a number of things. I mean, and in a way, well, just to kind of lay it out very, very briefly, I think what's most compelling to me of late is the whole matter of the psychology of the therapist and the impact of our own history, our own attachment history in particular, the history of our close relationships, the relationships that shaped us most fundamentally, the impact of those early relationships and subsequent relationships on who we are as people and how, speaking for myself, who I am as a person affects my efforts to be of help to my patients. I think that's what's most compelling to me. And, I think we've touched upon this briefly previously, but, you might say another piece of that picture, the psychology of the therapist, a piece of it is the therapist's, the way I put it is the therapist's stance toward experience, or you might say the stance of the self toward experience. And it's both a way that I think about what I bring to my work with my patients. It's also a way I think about my patients' strengths and vulnerabilities. And so when I say the stance of the self toward experience, I guess I'm thinking primarily about three possibilities.
So let me just slow it down because it's very rich and there's a lot in it. And in a way, I love that phrase, the stance of the self toward experience. And I want to first simply repeat it and invite people who are listening to us even to not necessarily try to understand it intellectually, but kind of get into the rhythm and the beauty or the images that it might evoke. And to have the curiosity of see the rest of this conversation unfolding as maybe giving it some dimension. And that's what we're doing in this experience, in this conversation is kind of meditating through your sharing some of your experience about that concept of the stance of the self toward experience.
Yes. Yeah. I was feeling appreciative of your saying, let's kind of slow it down. And also, the idea that maybe rather than trying to grasp these matters just intellectually, that we also try to, in a sense, embody these ideas as you and I speak. And so I heard what you were saying in a way as an invitation to be mindful, or an invitation to be present, an invitation to be in the moment with you as we share a half hour or so of our time together. I really appreciate that.
And so, so in a way, this exchange and then this sharing, we are in some way practicing the stance of the self toward that shared experience we're having, whatever that means. But, in some way, we're doing part of that.
Yes, that's exactly right. And especially the mindful piece. So, for me, this gets a little theoretical, but I find it a helpful way to think. I think we can have a stance toward experience which is one of what I call embeddedness. And that's a stance in which we're kind of on autopilot. We're, you might say, believing everything we think and feel. We're not taking a step back from experience in order to try to make sense of it, which is what we do when we're in a reflective, as opposed to a stance of embeddedness, a reflective stance toward experience. We're taking a step back, we're trying to understand it. What's the context? What does it mean? How does it add up? Why might I be experiencing this moment, this relationship in the particular way that I'm experiencing it? That's a reflective stance. And then there is a mindful stance, which I think is, I suspect you know, a mindful stance is one in which we're present deliberately. We're present on purpose, and we're trying to be aware of what is our experience in the present moment. We're in that experience as fully as we can be. And for me, all three of those stances, a stance of embeddedness, a reflective, or as it's called in the attachment literature, a mentalizing stance, where we try to make sense of experience in terms of underlying mental states, like what we believe or what we feel. All three of those stances, and the stance of embeddedness, a reflective or mentalizing stance, and a mindful stance, they all have a place. When we're making love, or listening to music, or making music, or getting out of the way of an onrushing truck, a reflective stance, a mindful stance, that might not be exactly what's called for. You just want to be in the experience and do what's called for. But I think a lot of the trouble that you or I or the people we're trying to help or the people we relate to can get into, I think a lot of the trouble comes up when they are, you might say, stuck in a stance of embeddedness. And they're believing everything that they think and feel, and they can't take a step back from it, and they can't try to make sense of it. And in a way, perhaps they can't even be entirely present for the experience because the past is so gripping, and what they believe, what goes on inside, the lens through which they take in what comes in the way of experience is so fixed. I guess what I'm saying is that for all of us, being embedded in experience can at times be problematic, and it's a real resource to be able to step outside of our experience for a moment to try to make sense of it, or to deliberately try to simply be present for our experience, in which case you might say the past is, subjectively speaking, kind of sheared away, and the future, subjectively speaking, is kind of sheared away, and we're just, right here, right now. I think all three of those experiences can be fine in their place, and flexibility seems to me is a big part of what I'm trying to cultivate in myself and in the people who come to me for help.
So, David, what I find very wonderful in there is you're not saying there is one thing that's good and others that are bad, and there's a time and a place for it, and you're talking about having that flexibility and that flow of finding something that's appropriate.
And
another part is there's something very visual about you're using the word embeddedness. That embedded is, say, the journalists who were embedded in army during the Iraq War and things of that nature, you disappear in it, and you're swallowed by it, and you lose your perspective because you're all surrounded by it. And in contrast to that, the mentalizing and the mindfulness are a way to actually not just be swallowed by it. And there's going to be a difference between the mentalizing and the mindfulness, and maybe we can come back a little more to it. But the first part is really that sense of not being swallowed. There's more than just being in the experience, having said, as you did, that sometimes you do want to be swallowed in the experience.
That's right. That's exactly right. I was just thinking that part of the problem with embeddedness, if you will, is that we lose a sense of ourselves as initiators, creators of experience, agents, people who make things happen. If you're embedded in experience, it's as if experience is happening to you. When you take a step back from experience in order to try to make sense of it, you're taking a hand in shaping your own experience. It widens, it seems to me, widens the scope for a certain kind of mental freedom. And I think actually by a different route, I think mindfulness too expands the scope of mental freedom. It creates mental space. And I think whether one chooses to reflect or chooses to try and be present, one is making a choice about how one is going to respond to one's experience. A deliberate choice. I'm going to try to make sense of this experience, or I'm going to really try to be present for this experience. There's a choice there. There's a decision about how we're going, in a sense, not just to, it's a little cliche, but not just to react reflexively to our experience, but to deliberately choose in one way or another to shape our stance toward our experience, either in the direction of greater understanding, we're trying to make sense of it, or in the direction of greater presence, trying to really be right here, right now for our experience.
So I want to reflect that, part of the invitation of the conversation was explore the stance of the self toward experience, and we're right in the middle of it. And
that's right.
So what you pointed out is the difference embedded. We're actually not in a position of taking a stance because we're carried by events.
That's right.
And the mentalizing and the mindfulness are actually, we are taking a stance, and there is a difference in both cases. And to try and maybe get some kind of a visual or embodied analogy to it, the mentalizing part is a little bit like in a battle, the general is on a hill and watching the armies on the plain that are fighting, and has that overview, and from that place is able to make decisions because he sees the situation as a whole, and he's able to see from afar and decide. And maybe the mindfulness is the part where instead of, in a way, having that overview from the outside, the bird's eye view, is a sense of actually getting a sense of it. So, which is different from being carried in it powerless, but maybe having a sense of oneself being fully alive in the experience, and the sense of the resonance in the self of what the experience is. So does that,
Yeah, you seem to be quite fond of these martial metaphors. But, actually taking a step back from, like I was feeling in some ways embedded in our conversation. And then I caught myself and decided, well, I wanted to take a step back from the immediate reality of our conversation, which I'm enjoying. And taking a step back, I had a sense like, well, I want to do some talking now about something a little bit different. I want to do some talking about that whole matter of the therapist's attachment history, the therapist's attachment patterning, because, I wrote a book, I guess it came out in 2007, called Attachment in Psychotherapy. And so, as the author of that book, I have to say something about attachment. I mean, I'm very, very, very persuaded that it's in the context of our formative attachment relationships that we first start to become who we are, and that in the context of our new attachment relationships in psychotherapy or perhaps marriage, that in these profoundly important relational context, that's where we have the potential to change. But what I find really compelling is and many other people do obviously as well, is you might say the analogy between what we attempt to provide as good parents on the one hand and as good therapists on the other. I think there's a certain kind of, there's a lot of overlap. I mean, both the relationship of a parent and a child, the relationship of a therapist, and these are both relationships whose purpose largely is to foster development, is to make healthy development possible. You know, in childhood, we want to make it possible for the first time. In therapy, we want to make possible, you might say, the resumption of healthy development. And it seems to me that it is a relationship of attachment where the therapist is a kind of, like the parent to the child, the therapist is a kind of stronger and or wiser other to whom the patient turns hopefully for an experience that will be reparative or healing, you know, in some way an improvement upon the initial relationships that left us, you know, with certain strengths, of course, but also certain vulnerabilities. And I think that when you pay attention to that, like when I pay attention to that analogy between what we provide as good parents, what we try to provide as good parents, and what we try to provide as good therapists, when I pay attention to that analogy, a major part of what I see is the following. Just as the parent's own attachment history has been shown, and the parent's relationship to his or her attachment history has been shown to be incredibly powerful as an influence upon the psychology of the developing child, it seems to me in very much the same way, the history of the therapist and the therapist's relationship to her or his own developmental history, her or his own attachment history, that's an extraordinarily powerful influence on the therapist's ability to create a developmentally facilitated relationship. You know, it's like, in a nutshell, the research shows that secure parents tend to raise secure kids. Insecure parents raise insecure kids. Traumatized parents typically re-traumatize their kids. And I think much the same thing is true in psychotherapy. In other words, that the therapist's security, insecurity, trauma is going to be manifest in one way or another, recognized or unrecognized, as an influence on how that therapist relates to the patient. And I guess I'll just say one more thing, which is that what seems really key there is that just as, you know, if you think of yourself as a parent, you know, you might have all sorts of criticisms of your own parents' parenting, but as a parent, you can often find yourself, you know, with subsequent regret, perhaps, kind of channeling your own parents. In other words, you do, as a parent, a lot of stuff that you wouldn't necessarily choose to do, but you do it. And I think the same thing is true of our conduct as psychotherapists. We relate to our patients, it seems to me, much of the time, kind of on autopilot. We're just doing our thing as therapists. And sometimes that's quite constructive, but sometimes what we're doing is a function of our own history, our reactions to our history, our own psychological needs. And sometimes that's not just unfolding, as I say, automatically, but to the detriment of the patient. It's an interference in the therapist's own efforts to be of help to patients. And I guess I'm suggesting that stuff is going to happen. It's going to unfold sort of automatically. And then the question is, can the therapist, you might say, adopt something other than a stance of embeddedness as he or she does the work of therapy? You know, ideally, I guess what I would suggest is that we aim to cultivate the ability as we're working with our patients both to be present, to really notice, to be right here, right now, and notice what are we actually doing with our patients. That's number one. And number two, to be able to adopt a stance of a kind of a mentalizing, a reflective stance, so we can take a step back from our sense of what we're doing with our patients in order to try and make sense of it. And I think those efforts to be mindful, to reflect on the experience that we are now able to be aware of, label, describe, that when we're able to take a step back on that experience and reflect on it to try to make sense of it, it gives us more freedom, number one, with regard to how we conduct ourselves. We're no longer on autopilot. And number two, because the relationship we co-create, I would say, with our patients is, you might say, a dynamic system. I'm influencing the patient who's influencing me, who's being influenced by me in turn, and so forth. When I become aware of what I'm doing with a patient, typically it bears a meaningful relationship to what's going on in the patient. In other words, it's not solely a function of who I am as a person. It's as if the parts of me that are manifest as I relate to the patient are activated by something that's going on in the patient. It's in the chemistry between the two of us. And so when I become aware of what I'm doing, usually it opens a window on what might be going on, not only in my psychology, but also in the psychology of the patient and in the relationship that we're creating together.
Yes. So maybe I want to play it back a little bit in a slightly different way to just check that we're on the same wavelength. But
excellent.
In a way, parenting is not just about having the good intentions about parenting or reading a parenting book.
That's for sure.
You're going to be, influencing and creating and shaping your children based on what's going to come out from acting out what you have in yourself. And so knowing yourself and having that ability to both reflect on it and be mindful about it is going to make it possible for you to actually be a more effective parent. And in the exact same way, as a therapist, if you just try to be a good therapist, you're actually going to be playing out a lot of your dynamics that you don't know. So you have to know yourself in both that mentalizing and mindful way in order to be able to influence a relationship, to make it one where it's possible to actually change.
Yeah, that's very, very, I would put it very much the same way, that our parenting, it may be affected by what we read or what we hear about good parenting, but a lot of it just kind of unfolds and plays itself out as a function of who we are as people and how we've been parented. And so if our parenting is going to change, we have to become aware of what we're doing as parents. And try to make sense of it and try not to be so gripped by it. And I think very much the same thing is true of us as therapists, that another angle on this is that as therapists, it seems to me that it's who we are that ultimately is decisive for the relationship's potential to be healing. It's not so much our theories or the techniques we've learned, it's who we are as people. And, who I am as a person is going to manifest both for better and for worse. And it seems to me to some extent, to a large extent, I think the key to my using my history and my own psychology in the patient's interest, the key is to is to be mindful and to mentalize. In other words, the key is to try to deliberately attempt to become aware of what I am doing, not to be on autopilot, but to become aware of what I'm doing, and then to try and make sense of it in a fashion that informs me both about myself, but also usually about the patient.
And so, as I'm hearing you, actually, what feels, like slowly coming back is, in a sense, the obvious part but that feels very profound, that a parent is not a robot. That if we're talking about attachment and we're talking about relationship, we're talking about human beings.
That's right.
And so that the parent is not a robot or a machine, but it's all the human qualities of the parent, and also the ability of being not embedded, but both mentalizing and mindful, and have these human qualities that are going to affect the parenting. And in the very same way as a therapist, we're not providing treatment, but, we are very much creating an experience.
That's right. That's right.
We're present in that role of parent/therapist.
Yeah, that's right. That's right. Maybe I could give just a quick example to try to, make this more vivid, bring it to life a bit. This is an example that basically involves my relationship with a patient who I'd seen already for probably for a couple of years, and I'm sitting with the patient. The hour's gone on for 5 minutes or so, and I realize that I'm starting to feel a little drowsy, and that caught my attention. And when I tend to feel drowsy, I always ask myself, kind of like what's going on around here, or even more specifically, sometimes I'll ask myself, what is it that I might not want to experience? Why might I be shutting down? And so when I ask myself, as I'm sitting with this patient, why it might be that I was shutting down, I realized that it was because what I was doing with the patient was absolutely nothing. In other words, I was in my mind, what I was doing, as I kind of asked myself, what am I doing? This in a way is the mindful piece, to try to get present. When I was shutting down, when I was getting drowsy, I was not present. But as soon as I asked myself, what is it that I don't want to experience here, I started to wake up a little bit. And when I asked myself, what am I actually doing here? That's a little bit like what I do when I meditate. It's like, I'm just paying attention. What's coming up? What am I doing? What's coming? I'm thinking, feeling, sensing a pain in my back. So I was doing something similar in the therapy. It's like, what am I doing? And again, what I realized, I was doing absolutely nothing. And it was sort of billed as I was making room for the patient to think his own thoughts and feel his own feelings. But then when I tried to reflect, and usually when I reflect, I ask myself two questions. The first is, what might be the implicit meanings of what I'm doing? So what might it mean to me? What might it mean to the patient that I'm doing absolutely nothing, that I'm keeping my mouth shut? And then the second question is, what might be my motivations for doing what I'm doing? And so what I realized as I asked myself, what's the meaning of what I'm doing? I realized that beneath the surface meaning, which was just making room for the patient, was the fear that were I to say anything, the patient would experience it as an interruption, as a destructive, hurtful incursion on his experience, his thinking his own thoughts, his feeling his own feelings. And I became aware that I was fearful that he would get angry at me. Mm-hmm. And then when I asked myself, what were my motivations? What might be my motivations for saying and doing nothing, for being so fearful of his anger at me? What I realized, what I tuned into, was just a kind of an abiding fear I have as a person, generated, no doubt, largely in the context of my relationship with my kind of Dr. Jekyll and Mr. Hyde-ish mother. What I was afraid of, I think, was seeing myself or being seen as I was seen by my mother at times as selfish, destructive, bad. And what's interesting is that for me, going through that kind of process of getting present, noticing what I'm doing, trying to make sense of what I'm doing, checking out my motivations, what does my psychology have to do with all of this? It often opens up a whole range of possible interventions. I mean, it just, in this particular instance, what I chose to say to the patient was something like, I'm sure you're going to experience this as an interruption, but I feel like I'm caught on the horns of a dilemma. How can I be helpful if I don't say anything? And I was enormously relieved when the patient said something like, I know where you're coming from, because I can be quite prickly, and I've encountered a whole bunch of shit and misattunement, and so if you're not exactly on target, I can feel really pissed off. He said, but you've got your dilemma, I've got my dilemma, and the way he put it, this is like his metaphor was, if I come out of my room. Because in his childhood, retreating to his room was safety. Mm-hmm. So he says, if I come out of my room, my experience tells me I'm just going to bump into the three-headed monster, which is his code for his very narcissistic father, his very seductive mother, his physically abusive older brother. Mm-hmm. And so I guess what I mean to illustrate here is that when the therapist starts to notice, gets off autopilot, gets mindful, pays attention to what's unfolding in the moment, what is the therapist actually doing, and then when the therapist reflects on what he or she is doing, it opens things up in a way that's not only important in terms of allowing the therapist more freedom so that the therapist can loosen the grip of his or her own history and his or her own psychology, but I think it also makes possible a kind of deepening of understanding of what's going on with the patient, and often a deepening of connection to the patient. In this instance, what followed were, it basically opened up a whole new terrain, which had to do with the fact that my patient felt like he could be a member of the audience and listen to my monologue, or he could deliver a monologue and I would be relegated to the status of audience member. But what he felt like he had such a difficult time doing was, actually it was what he came to call mind jazz. Right. Like that's what he was aiming for, we could riff off each other, we could improvise, we could create something together. Yeah.
So it's such a beautiful, beautiful, beautiful example, because it's like you see the interplay of all these elements. And so I want to play back a very, very small version of it, that doesn't capture all the richness of it, but you're showing first the difference between, like in an embedded mode.
That's right.
You can't, essentially there's no room for you. And so you make room for you, including what about me? And you showed the what about me, both in a mindful way and a mentalizing way.
That's right.
And the what about me is actually something that goes into the deep wound of, if I put myself in, it's inappropriate, or I get reprimanded, or I get, so there is, it's a big step to actually at that moment fight, that heritage of attachment. But what's happening is at that moment, you are actually making the ghost of attachment past visible in the room. And your mother, which was kind of hiding and this, manipulating things, suddenly becomes visible, and you have some action on it. And as you do that, you are actually in a position where you've overcome that dominance of your past, and you make it possible to actually break free. And instead of both the patient and you being prisoners of your past and the all or nothing or monads, basically there suddenly is a possibility of human beings in a dialogue or in a jazz improv. And it feels so beautiful, the way all of these things work together.
Yeah, that's such a lovely, lovely restatement. And it's pretty, maybe it's in the great minds think alike department, but I just found myself thinking about two things that I've said often when I teach. One is, for the patient to heal, the therapist must change. Mm-hmm. And somehow, like what I heard you saying was something about how, like in the vignette that I just presented, that I kind of I became less a prisoner of my past. Mm-hmm. I changed in that moment. And I think that opened something up in the relationship that made it possible, ultimately, for the patient to begin to change.
Yes.
So that was one thing. And then the other thing that I talk about a lot in my teaching is how, in a secure state of mind, a relationship is experienced as a setting in which there's room for two.
Yeah.
But when we're in an insecure state, a relationship is a context in which there's room for one and one only. And I don't know if the attachment lingo is familiar to you, but in the attachment lingo, we talk about a dismissing state of mind, and that's a kind of a cut-off, sort of obsessive, narcissistic, schizoid kind of state of mind, you might say, quite shut down. And there's only room for the self. Mm-hmm. Or there's this kind of hyper-activated, to use some old diagnostic jargon, it's kind of more hysteric, emotional state of mind. There's only room for one, but that one is the other. Mm. So I think in a way I was gripped by a sort of preoccupied state of mind in which there was only room for one, and that one was my patient. Mm-hmm. But that didn't serve my patient. I couldn't be helpful in that imprisoned state. And so I had to change in order to make something new possible in the relationship with the patient.
Yeah, yeah. And again, that's so rich there, but what I think is really important, that part where it's a little different from, say, the part that says therapists must do their own work in order to be able to be good therapists. The dimension that you're saying is not just they must have done their own work and it's done, but it is happening in the session.
Absolutely.
It's not that you had done it in the past, because of course you've done it. But what's beautiful in it is the therapist is changing in the session, in the moment, and that's what is creating the possibility of change.
I certainly see it that way. I mean, for one thing, I don't really subscribe to an image of, healing that is ever complete. Ultimately, I mean, I think our healing I think we are, those of us who choose this work, almost all wounded healers with a very problematic past, a more or less problematic past, but problematic. And I think, the work of our healing is lifelong, and we're going to continue to manifest in our intimate relationships with spouses, kids, parents, and others. We're going to continue to manifest some of our woundedness, you might say. Mm-hmm. And but the key, the important thing is, I think, to be as open as possible to an awareness of the manifestations of that woundedness as we work with our patients. and to do a little, perhaps you might say, to do a little healing on the spot, which I think has the potential to open things up, both for the therapist and the patient.
Yeah. This is a great place to maybe
to wind up,
to wind down, and just that's it feels like that sense of both the therapist and the patient are wounded and are engaged in a process of healing.
That's right. There's a very well-known writer, analyst in the relational psychoanalytic tradition, a guy named Erwin Hoffman, who recently said something like this: there is a very simple truth. We, therapists, we are the patients. This is really a large self-help group.
This is part of the Active Pause podcast. To see more and subscribe to the newsletter, go to activepause.com.